Let's talk about BDZ drugs. These are depressants that produce sedation, hypnosis, relieve anxiety, muscle spasms, and reduce seizures. These can be many drugs, including Valium, Xanax, and more. They aim to treat depression, anxiety, and insomnia. But how do they really work? Well, they are known to slow down activity in your central nervous system or your brain. This happens from an increase in GABA. This is a neurotransmitter known to slow down the brain by causing a blockage in a specific messenger in the central nervous system. I like to think of GABA just like your grandma, because GABA and your grandma have many things in common. Number one, they both are slow. That is GABA's intent, to slow your central nervous system down. They also both create a soothing effect, and that is why they're used to aid anxiety, depression, and insomnia. But they can only both be used in a short amount of time. You only visit your grandma, and BDZ drugs are only used for 2 to 8 weeks at a time. This is an issue because even though they are prescribed for 2 to 8 weeks, does not mean that they are always being used for 2 to 8 weeks. Let's talk about the not so fun facts. 526 adults in a recent study who received BDZ prescriptions from 2008 to 2013, out of that number, 152 still had the prescription a year later. In supporting fact, every 10 additional days of medication prescribed doubled a patient's effect and risk for long-term health effects. Well, what are the long-term effects? There's been a recent study that links BDZ abusers to an increase in Alzheimer's. Your liver is metabolizing that drug, and that can cause tissue damage. Your heart is also being slowed down to cause that anxiety relief. This can increase blood clots. Getting off BDZs after a long term of taking them. When your body gets GABA synthetically handed to them, there's no longer a need for natural production. So your body simply stops doing it because it relies on you taking that pill. When you naturally get off of that pill, it can't produce it anymore. So there's an increase in anxiety, stress, more than even originally intended, and in some cases, an increase in blood pressure. Now that you've gotten to know a little more about BDZ drugs, let's talk about how we can advocate and prevent the longevity use that is more common, even though they're prescribed to 2 to 8 weeks. Just like the previous study mentioned before, 1 in 4 adults still are using their BDZ prescription after 1 year, which can create the long-term side effects that we want to prevent. BDZ drugs are also known to have a high resale rate, as patients are using them after a year and selling them to campuses, to workplaces, anything that has a high stress level. So what we can do is create awareness, let people know, and research the drugs that we are being prescribed.